Morning mofos, Sunday, rare day off. Mrs Mofo's still got me working. So we're getting a lot of people asking questions about pain on the outside of the knee, which they presume is coming from the IT band, which it may or may not be. So a couple of things. Your IT band's really thick, doesn't stretch. If you had a blow to your leg, so a dead leg of some description, and you develop compartment syndrome, it's so thick and so inelastic that they have to do what's called a fasciotomy to cut through it. So if it was that easy to change the length, surgeons wouldn't be putting people under the knife. However, with the use of a foam roller, the IT band does become single-stranded, just as it kind of just goes around the knee. And there's a muscle just at the top of the hip called tensor fasciae lata, which again, if we can trigger point that, will make a big difference to the length of that fascial band, and then probably the pain that you're getting on the outside of the knee. So with your foam roller, we're going to get into position. Now, one of the common things I see when people foam roll is this preponderance for them to just roll up and down. Now, thinking about the direction, the fibre direction of the muscles, you'll also be advised to not just go oscillate up and down, but also to roll side to side. So what you're doing is actually breaking those tissues down, any adhesions between the fibres. You can have a greater chance of breaking those adhesions down, moving from side to side, as opposed to straight up, straight down. So piece number one, which is the side of the knee foam rolling, and I'd keep going on this for about 60 to 90 seconds before you then move on to piece number two with our trusted lacrosse ball. So TFL sits on just to the side of the anterior superior iliac spine. I'm just watching the dogs out in the garden. So if you find that bony prominence on the front of your pelvis, you can't miss it. Take the ball, pop the ball just onto the inside of that, and then transfer your weight on top of the ball. Imagine this is my elbow. Once you've found a position where you've got some discomfort but not pain, we're going to camp out there, allow ourselves to relax onto the ball, and then once that relaxes, we're going to start to move the bottom leg. Now initially, first couple of reps, this will feel pretty awful. As your muscle starts to ease, so this is trigger pointing, you'll find that gets easier and easier to bring your heel closer towards your bum. Once you can get your heel as close as you would normally be able to get to your bum, roll around again, find another bit that hurts, and repeat the same process. Alright, so a quick fix, Sunday morning quick fix for you mofos with lateral knee pain. Don't roll here, trigger point here, job done.